all with different payment structures. The second or third largest department in our hospital by people is our business office.
Would you bet on single payer within the next 10 years?
No.
Really?
No. No.
What do you think of Trump's idea that...
We can't even get, I'm sorry, we can't even expand Medicaid.
I know.
So,
I know.
much less
Right.
single payer. Yeah.
Trump last night said, we'll give tax credits. I turned to my wife and I said, well, most of the people that need health insurance don't have enough income to even be paying taxes.
They're not itemizing taxes,
So
no.
It's not a
No.
good idea.
No, it's not.
What is the relationship between the hospitalist and all the primary care physicians? As a patient, I'm fearful, in pain, unfamiliar surroundings.
Yes.
And here comes this person I've never laid eyes on
Yes.
before saying, I'm your doctor.
Yes, absolutely. That's a great point. So let's talk about the relationship to the patient first, because you just outlined that. It is a new provider. It's not your family practice doc that you've known for years and trusted. So that's a challenge, and that's important for the hospitalist to be able to establish that trust. The relationship back to your provider needs to be one of good communication, so that they say, hey, I saw Mr. Johnson in the hospital today. He's got pneumonia. I think we're going to keep him for a couple of days. His estimated discharge is on Monday, and he'll need to be on these medications. I've contacted your office to set up a follow-up appointment. So it can work like that, and early on it didn't work like that because we didn't think about it, right? And so I think we're working out what those things are, but it's really an information construct, and it's also why electronic health records are so important. So your doctor could log on, open up our portal, and look at all the notes that the hospitalist has written, the lab results, the imaging results, how you're being cared for, and what your discharge plan is on the electronic health record.
But if you've never been a patient at the hospital, how does the hospitalist get to your personal records?
Well,
Physician's office.
great question. So we're on Cerner. There's about 4 main platforms for electronic health records. We're on Cerner, which is a Kansas City company, and all of our employed providers are on Cerner. So if you're at one of our employed practices, that hospitalist can pull up your record just like that and see your results. Yeah.
Ray, we've had 2 experiences with hospitalists separated by about 4 years, and I'm convinced that the first one was so overworked that he couldn't, no matter how good he was, he couldn't have developed a relationship.
Yeah.
The last one, just last month, did not appear to be overworked.
Yes.
So, and that's got to make a big difference.
It makes a big difference, and it waxes and wanes. So we can go from 112 patients in-house down to 50.
Yeah.
And so our hospitalist staffing waxes and wanes from that. It's not a perfect model, but I think there's absolutely no going back to the other model. Because physicians coming out, A, won't do it, and B, it's not clinically safe, I don't think anymore, to expect a physician to try to be able to manage acute medicine and primary care. So, yes?
I don't know if this is quite in your area, but
I'll make something up if it's not.
what do blood tests cost these days? Have the prices gone up a lot?
Blood tests?
Yeah.
Probably. Prices of most everything have, but
Dr. Freely, who was over in Kansas City, who Johnson County, and he does his work out of Menora Medical Center.
yes,
And he did a procedure on me to check on my liver.
Mm-hmm.
And after everything was over, the last time I went back to see him. He ordered a blood test just to check to make sure everything was the way it should be.
Mm-hmm.
Well, it took a while for the bill to come in for that test. It cost over $800.
Mm-hmm.
And I'm thinking, what in the world?
Right.
I can't afford that.
So
And
that's a good.
insurance, Medicare turned it down.
Yeah, that's a good example of complexity in healthcare. So there's probably 30 kinds, 40 kinds of blood tests now. from a CBC, a complete blood count, to a whole panel on liver and enzymes and all kinds of, I'm not a clinician, but you know, that's a good example of $800. I mean, how do I pay that for a test? So, yes.
Could you talk a little bit about the endowment?
Sure. Love to talk about the endowment. We have had an endowment for many years, but actually really focused on it for the last 20 years under Kathy's direction. We have we're actually recruiting a new leader of the endowment right now. The endowment has probably contributed about $22 million to the hospital over the last 15 years or so. It's a vital part of our work. It has a board of about 23 community members and a staff of 4. So the endowment's sole purpose is supporting the needs of the hospital, and right now they're raising funding for a new cath lab in our cardiology space and a variety of other projects. So they're a great organization and a very committed group of people. We're blessed to have them.
They've hosted great parties in the past.
Yes, they have, and we'll keep those up. So,
Russ, I think it's
Thank
time
you.
for us to, and we really appreciate.
don't want to wear out my welcome.
We're glad you're on this ship of state,
Well, thank you.
Guiding us
I'm
through
glad
the-
to be here.
torrent waters.
Yes, it is. Thank you all.